I'm really pleased to be able to welcome you this afternoon to the Healthcare Science Awards. There are two Healthcare Science Awards. One is for the Team of the Year and the other is for the Innovation of the Year. So healthcare scientists work across the Trust. They work in many different areas, often behind the scenes. So we have healthcare scientists in the laboratories and they often working off-site, and there are many of them working in the laboratories doing everyday diagnostic tests which help doctors and nurses make their diagnosis of patients. We also have healthcare scientists working in physiology, such as cardiology, neurophysiology and respiratory medicine, and also in audiology. They see patients every day and they are involved in diagnosis and treatment.
So we're the Cytology from the Cytology lab over at the Cotman Centre, and for the last year we've been heavily involved in COVID testing in the early stages in lockdown 1, and it meant that we needed to run the lab later in the evenings and weekends, supporting our virology colleagues in making sure that as many patients and people in Norfolk and Waveney got their COVID results as soon as possible. It's genuinely a real honour that we've been recognised for all the work that the cytology team that have come in doing overtime and working extra hours for the course of the last year.
Thank you.
Thank you. Oh,
It's yours. It's yours. I am one of the two co-principal investigators on the Novovax COVID vaccine study, and on behalf of myself and the entire team, I'm really delighted that we have been nominated for this award. The research team at the clinical research facility and in the R&D department are one of the great strengths of this organisation, and I'm really, really proud to have worked with them and to see them being nominated for this award.
Presenting you with the award, so congratulations on behalf of the team. There's been quite a few projects in the last year, 18 months. Myra's department has completely rebuilt the laboratory, so we've gone from, because we're now part of EPA, providing services for biochemistry across Norfolk, we've obviously our workload's gone up substantially, so we needed new analysers. So they stripped the laboratory and rebuilt with new analysers. And Myra's team have been doing that. And I think the glowing part of that for her team is that actually probably 90% of the hospital didn't know it was going on, as in they appreciated it was going on, but actually the effect, knock-on effect to the medical staff and the patients wouldn't have been noticed. And bearing in mind, we'd gone from auto-analysers to manual. It was like when me and Myra started 20 years ago, and then back again. It's a huge achievement for her and her team and staff.
Wow.
I'm overjoyed for our team. I work with a fantastic team. We have worked so hard over the past year or so. We've had many challenges and we've overcome them. We are a dedicated team, and we've had a great support from a number of people that have come to work with us, including volunteers from the Science Park, people that have had finished their PhDs and then come to work with us as bank staff or on fixed term contracts, and we've all risen to the challenge, and without disputes and arguments, we've just really gelled together and been a fantastic team. So yeah, on behalf of the team, I feel really honoured to accept this award, which when we get back, I think they'll be amazed and overjoyed to receive it, because it's a real nice thank you for all hard work. So thank you very much to everybody.
I feel very proud that we as a team have been nominated. The team have moved from face-to-face follow-ups to remote patient follow-ups for the patients, which is reducing the amount of attendances for patients to the hospital. It's especially good for our dementia patients, so they are doing their pacemaker checks at home.
To get this nomination, we launched a digital programming service for hearing aids and sound generators, and whereby patients can stay at home and still be fitted with their digital devices, and we remotely program them. I feel very proud that as part of the hearing therapy and audiology team we were nominated, and it feels like we've paid a small contribution to the problems that have been experienced during the pandemic.